The Neuro-Oncology Program is a member of both the Hematology and Oncology Center and the Neurosciences Program here at Cook Children's. And one of the focuses of the Neuro-Oncology Program is to focus on brain tumor research in children. And the way we do that is we're a full member of the Children's Oncology Group, which is a national, actually international organization that focuses on the treatment of children with cancer. Cook Children's is also an inaugural member of the Texas-Oklahoma Pediatric Neuro-Oncology Consortium. It's a big mouthful. This is a new consortium that's been developed in the past year to specifically focus on brain tumor care in children in the state of Texas. The consortium, the Texas-Oklahoma Neuro-Oncology Consortium, is actually beginning a new brain tumor trial that will be ready for newly diagnosed patients within the next 1 to 2 months. It's a trial for patients with so-called high-grade gliomas, a relatively rare but unfortunately devastating type of childhood brain tumor. And so all the institutions in Texas, Cook Children's and other institutions in our state, have decided to join forces to begin new treatments for patients with this type of tumor.
It's called an intrinsic brainstem glioma. And intrinsic meaning it's inside the brainstem. Glioma is the type of cancer that it was. And so because it was that type of cancer, there were no options available. We called St. Jude Hospital and to see what kind of treatments are available, because if they're the leading research for pediatric cancers, there has to be something available. And they said, no, we don't have any open case studies for a glioma. And so I said, well, can you refer me to somebody who you might think? They said Baltimore. Baltimore is doing some type of study on glioma, so call them. So we called the Children's Hospital. And everyone we talked to was the head of their departments. It wasn't a secretary. And they said, we're sorry, there's no research available. We called over to Germany, a children's hospital in Germany. They didn't have any open research for us. We called several major hospitals, and there were no studies available, which Dr. Murray had already told us, and we trusted his word. But as parents, we wanted closure on it to see what we can do to help fight this with our boy. And everything came back and there was no options available. And our only resort was to either take the treatment of radiation or to come home.
The first trial within the Texas-Oklahoma Neuro-Oncology Consortium is for patients with high-grade gliomas. And we'll be looking at two, not brand new drugs, but two drugs used in a different way for children with high-grade gliomas. We're looking at the use of a drug called Avastin, which is an anti-angiogenesis drug for vascular brain tumors. We're also looking at a drug called valproic acid, which is actually an old-time drug used for seizure control. And it's thought that this medication serves as what's called a histone deacetylase inhibitor, HDAC inhibitor, which may reduce proliferative growth of high-grade gliomas.
And you think sci-fi when they're going to research on a part of your child, but we sat down and said, we're not the first family that's ever gone through this. We won't be the last, but the information they gain from any research they can get may help another 4-year-old little boy in our shoes one day. And that's what our goal is, because there needs to be more research done. There needs to be an option. There needs to be funding made available. There's just so much that still can be done.
We hope by collaborative efforts like this, particularly for patients who have relatively rare tumors, when we have new medications available, which we do now for certain brain tumors, we hope that with clinical trials and cooperative efforts, we hope that the treatment success will be improved as time goes on.
As soon as we went into Cook's, we met family after family after family who had lost their children, who were battling, right now for their child, just like us. And so as soon as Dr. Murray mentioned that we could donate the tumor to research, yes, we definitely want to do that, because even though we knew we weren't going to get more than 12 months, because they told us that from the beginning, even though we knew that, I really hope that other families don't have to go through this.
I think any physician in my specialty, particularly dealing with children who have relatively unusual diseases such as brain tumors, for us to not participate in clinical research and not be part of special consortiums and trials would be a disservice to our profession as a whole, and certainly to the children that we serve here in Fort Worth and at Cook Children's. In order to provide cutting-edge specialty care, we have to be part of the clinical research milieu, both locally, regionally, and nationally.
Anything we can do to further research to help these kids to find a cure. It's not going to save Kendrick. It's not going to save many of our friends' children, but somebody is going to be saved. Somebody's little boy is going to be saved.
It's a great feeling to help children and to give back to families, and really knowing in our hearts and in our scientific minds, if you will, that we're giving the absolute best cutting-edge therapy available anywhere in the world. We feel completely confident that all the children who walk through the doors here at Cook Children's Medical Center are getting absolutely the best therapy that they could get at any other institution in the entire country.